You're unmuted.
Hello and welcome to the webinar on supporting development of the Innovation Gateway and the metadata onboarding. Thanks very much indeed for joining. We've got a number of people on the line. There's myself and Adam who will be sort of going through the slides and answering your questions. As participants, you're all muted and we're not able to sort of hear from you, but we can see any questions that you may have. And again, as per the chat message, if you could post those ideally in the Q&A, then we can pick those up as we go through the slides. So I'll just step through what we're aiming to get out of this session. Really, it's very much familiarization. It's to give you the chance to ask questions that you may have around the sort of the additional investment in the onboarding of the metadata. But before we get to the sort of the details of that, I wanted to really just make sure that you knew who everybody was and that we gave you a quick bit of context in terms of the overall health data research infrastructure that we've been building for a number of months now. So I'm David Seymour. I'm the Partnership Director here at Health Data Research UK and also the lead for the UK Health Data Research Alliance. Do you want to let Adam introduce himself?
Hi there, I'm Adam Millward from Metadata Works, and I'm working with HDR UK to coordinate the onboarding process.
Thank you, Adam. And as you'll probably noticed, we're not in the same place, but we will do our best to make sure this is as seamless as possible. So in terms of the sort of the overview of the piece, hopefully most, if not all of you, have seen this slide before, but I think again it's just worth having in the back of our mind as we step through the ongoing slides and the need around metadata onboarding to highlight the sort of the three elements of the Digital Innovation Hub programme, Health Data Research Alliance, Health Data Research Hubs, and then the Innovation Gateway. And really the metadata onboarding is about meeting the needs across all three of these. It's allowing the Alliance members to make their data more accessible and discoverable for research and innovation. And it's about providing with Health Data Research Hubs with that data, but also with the functionality of the gateway to allow users to come in and start making sort of best use of the services that they'll be offering. And obviously, underpinning all of this is the patient and public benefit and making sure that we're acting in a trustworthy and ethical way when we use people's data. So the UK-wide capability, where are we today? Say it's an overarching programme funded by the Industrial Strategy Challenge Fund monies through UKRI. And it's about enabling safe and responsible use of health-related data at scale for research and innovation. We've currently got 25 members of the UK Health Data Research Alliance, including the cohort that are to be announced shortly. We've got 7 health data research hubs that cover domain and sort of functional areas. We've got the Innovation Gateway, which we'll talk a lot more about today. And then we also have a user group, we're calling the sort of sandbox, which help us to test different aspects of the infrastructure and how it's working or not working for their benefits. And we've put together the sort of roadmap and how we're working together going forward. In terms of the Health Data Research Alliance work streams, again, hopefully people are familiar, we've got 5 delivery subgroups that are being established and at various stages of development. The one around data standards and quality, we're just coming to the end of a draft green paper on that, which hopefully again people had the opportunity to comment on. Again, core to it is engaging and involving the patients, the public and the practitioners. We've got work coming out soon on trusted research environments, again scoping and defining the current state and also where we need to be in the future. And we're also working on promoting participation, improving access. But what we want to focus on today is the Innovation Gateway, moving ahead to the launch of the minimum viable product in January 2020. So the Gateway is the common access point to UK health research data for accredited researchers and innovators, but also an open portal for members of the public and the broader sort of community of interest around this. We're developing basically in, well, two main phases of development with 3 actions in phase 1. This minimum viable product is very much focusing on discovery and access, a very early stage of the access management. And the development of the portal is being led by IBM. We've then got the metadata catalogue, where NHS Digital and University of Oxford are coming together to deliver that. And then again, the focus of the conversation today is around the metadata onboarding delivered by Parity and Metadata Works. People may also be aware that we've just gone out to tender an OJU style expression of interest at this stage for phase 2, which is more of a 2-year program and a fuller technology partnership. And again, there's more details available about that on the website for those that are interested. So where are we trying to go with this sort of the overall portal? Well, hopefully a number of you may be familiar with Health Data Finder and the work that NIHR and others have done to put that together, which is shown on the left here. And I guess we think we're targeting sort of 4 additional benefits that we're looking for. Firstly, it's about trying to deliver improved user experience. So very much the work that IBM are involved in, the search and browse functionality, the first steps to the data access requests. And so that user experience is absolutely sort of paramount, and we really want to work on that. Secondly, we want to make more data sets available for discovery. So you'll see from the screenshot on the left that at the moment on the public facing Health Data Finder, there are actually only 18 data sets listed. And these are predominantly, if not exclusively, from England. What we want to do through this exercise is making sure we get UK-wide coverage, but also to dramatically increase the scale and the diversity of those data sets, particularly working obviously through the alliance partners, but also through the health data research hubs. Third piece is around tiered sort of functionality for registered users. So again, everybody was effectively treated the same through Health Data Finder. What we want to do is make sure that we're sort of starting to build out that additional functionality through a registered user login on that. And that also then drives the fourth piece, which is around greater insight on use, user needs, user behaviors through who's accessing what. So come to the metadata onboarding, and this slide really just tries to play out who and what is involved. So again, the elements I've already sort of outlined, I think. So we're really focusing on the bottom piece here, but we think it's about making sure that everybody understands how the whole bits of the jigsaw fit together. So without the input of you through the Alliance and through the hubs, providing that metadata and supporting this process, then obviously there's not an awful lot to display through the minimum viable product. We're lucky that the metadata catalogue, we're building on what's been developed through Health Data Finder. It's a very sort of agile and flexible tool, which has allowed us to sort of build out some of the metadata standards that Adam will talk a little bit more about later on. And I guess the key bit for this is that the priority for support and funding through both the work that Parity and Metadata Works will be doing, but also through the capital investment that we're able to make, will be with current Alliance members. The hubs get their funding through the DIH monies, and whilst a number of you will be aware there's an element of crossover between some of the organisations there, we want to make sure that sort of everybody gets the opportunity to be involved in this and have some funding associated with that. So thought it'd be helpful just to outline what Adam and the team will be doing in terms of their scope of work. And there's 4 components to this, all of which could affect you as individual Alliance member organisations. So the first piece is the rapid evaluation. We want to use this exercise as an opportunity to get a full view of as full a view as we can of the current landscape of both Alliance and the Health Data Research Hub's data sets. The metadata status, the readiness for onboarding, and also though the investment that's going to be required to develop a sustainable process for onboarding and updating the metadata in a timely fashion. One of the other things that quite often happens with portals, as I'm sure many of you may have had experience of, is that there's a lot of energy in the outset, and then unfortunately when you look back over 2-3 years later, you realise that the vast majority of information hasn't actually been updated, and there's no maintenance going on. We want to make sure as we develop this metadata onboarding process that it is something repeatable and sustainable, so that actually when users are going into the portal, they're seeing the most current and up-to-date version of the information available. Second piece is obviously quite a large coordination function here across both different organisations, but probably also different data formats and also different competencies within the individual Alliance members and the hubs. And so Adam and the team, we're working closely with both the metadata catalogue supplier, as well as providing advice and support to both Alliance members and the hubs so they can complete the onboarding process. And we obviously want people to be as self-sufficient as possible so that we can get the maximum amount of data sets or metadata uploaded for the resource that's available. Third piece is then about proof of concept. So for those more challenging areas, perhaps particularly for those organisations that haven't yet been involved with Health Data Finder, we're keen that Adam and the team are involved in a proof of concept for how that gets onboarded, not only the first time, but then also that sustainable piece, where there are opportunities to automate or simplify some of those processes as far as possible. So again, one or two organisations will have sort of more close working to develop that proof of concept. And finally, what we've asked is that at the end of the process, or at the end of this phase of the process, that opportunities to improve the efficiency, sustainability have been identified, and that where, as far as possible, they can be baked in to the technology. So that's the sort of investment in the, I suppose, the project and program team that Parity Metadata Works will be providing. We've then also been fortunate to identify some capital funding to support individual Alliance members with this. And as you'll have seen from the note that went out, there's basically two-phase approach to this investment. Firstly is to support that rapid evaluation of the within scope data sets across all the Alliance members. And then secondly, based on the outcomes of that, targeted support for the preparation and onboarding of metadata. Based on that, obviously, rapid evaluation work, and then a prioritisation on both the scale of the challenge, the perceived or actual value of those data sets that can be demonstrated, and obviously the resource that we've got available to do this. So, as I mentioned at the start, the minimum viable product is scheduled to be launched on the 10th of January 2020, but it's important to note that we expect the funding of the onboarding of metadata to continue until at least the end of March 2020, possibly a little bit beyond. Obviously, there is an imperative to spend the capital funds within year as far as possible. And so we're also keen to make sure that both the minimum viable product has a good depth and breadth of data sets available for discovery, but also that we demonstrate that it is an evolving portal and that new data sets come on board through that period from January launch through to the end of March. So there's a lot to get in, but we do have slightly longer to deliver on this than we have the actual launch of the MVP. So effectively on phase one and what we're proposing in terms of the funds available, we really, I suppose, first and foremost want to make sure that all of those organisations that are able to and willing to are engaged in this process. And so it's proposed that there be a payment of £5,000 to return the information requested regarding the within scope data set, but also providing basic access request process or documentation. So again, that we can start to pull that together. Now, for a number of the existing Alliance members that have been announced and in place since July, some of this data is already gathered on the Alliance specific website, ukhealthdata.org. And so it may just be a case of confirming really that data that is there and the websites it points to is correct. The data can be accessed in that way. For others who are perhaps newer to the process, obviously there may be some additional information to provide us on this. But actually, if one of the things there isn't that sort of formal documentation, or it's in an earlier stage of development, then that's just as important as knowing what the current and full version of that is. We're also keen to gather data access registers and also other transparency information, again, that you already use or communicate, whether that's via websites or other means. And again, that can either be the actual sort of register itself, or it could be links to them if that's being made publicly available. And again, equally important, if they're not currently being made publicly available, that you're able to sort of tell us that, explain that, and whether there are plans in place to make that information accessible and publicly available. And the timeline we're putting for that, we appreciate is tight in terms of a couple of weeks of turnaround. And obviously, in a way, if people just slip over the deadline, we'll probably still want to have them engaged and involved. And we appreciate that the money is probably only a small part of the challenge. Quite often, it's actually freeing up individual members of staff who've got the knowledge and the expertise to complete this. But we obviously also hope that by putting some investment in this, we demonstrate that it's not a no-cost activity, that all of these things do require resource to put them together, even at the sort of most basic level of information that we're gathering at this stage. Obviously, there is also then organisations have a range of different data sets that are available, from 1 or 2 up to sort of tens, possibly even hundreds in some cases, and therefore we want to know sort of what the costs or what the need is across those different data sets in terms of the extra information that will be required, and how related the data sets are. So actually, are they very distinct data sets where they're quite based on potentially completely different data models, completely different sort of topic areas, maybe even different modalities, or are they actually relatively related or derived data sets where a lot of the metadata may be essentially the same, and therefore obviously far less work to pull that data set together. And so there will be a little bit of judgment applied to this, and obviously we'll be looking to Parity Metadata Works to give us their assessment of those through their conversations that they have with you, but also for you providing the sort of the clearest information that you can about that piece. And that means obviously those that have got more data sets available have got the potential to have more investment at this stage of the process. Based on the outputs of the sort of within scope rapid evaluation, we'll then really be looking to provide targeted support to that metadata onboarding, and how organisations choose to fund that additional activity that may be needed, whether that's redeploying resource, whether that's effectively paying for overtime, paying for backfill, bringing in contractor support, whatever it might need, will really be down to the organisation. What we'll be basing it on is an assessment of sort of the level of funding that would be needed to secure successful uploading of the metadata, and also making sure that there's an agreed sustainability plan in place for ensuring the metadata is kept up to date and without additional external investment expected. Now, it may well be that some of that is through cost recovery, through data access request processes, and that would also be one of the aspects we'd want to think about and discuss as we go through this process. Very important that we make sure we think about all the aspects of sustainability on that piece. You'll hopefully have seen from the paper that obviously we do need to put a set of conditions against the investment. We've tried to keep these, I guess, as simple as possible, and they're sort of set out on this page here. But a couple of things just to pull out is that we want this to be is eligible to all Alliance members, and it's about them really being able to free up the relevant staff. We appreciate the timelines are exceptionally tight that we're all working towards. We realise that everybody's very busy, particularly going into the winter period, where there may be additional challenges, and so we realise the funding, may not replace all aspects of that, but we hope that it does indicate, as I say, that we acknowledge this is not a cost-free activity. Also like to just emphasise that this is about the metadata to support the discovery. This is not about changing any rights or control of the underlying data set or the data asset, and important to re-emphasise that the control of those, both of access and of the actual asset, remains with the data custodian at all times. What we are looking for, though, is the data custodian to grant effectively a royalty-free, unrestricted, non-exclusive rights access to the current and future metadata. Effectively, we need to demonstrate, obviously, at the end of this process, that there is an asset that this capital has gone in to invest, and that asset resides within the metadata catalogue and enables that discovery for those end users. I guess it's also about that commitment to keep that metadata uploaded to the catalogue, so ensuring that it's kept up to date. And I guess also just being clear that we don't expect, and we hope that nobody will be tempted to sort of game the approach in any way. And we'd just like to point out, obviously, that would be contrary to the letter of intent and the principles of participation. I'm sure that's not an issue we'll come across, but again, just important that people are clear that, obviously it's important that the investment is a good investment of public funds. Also worth just re-emphasising, this is a one-time investment to support the development and testing of the MVP, and it doesn't set a precedent for the future. And so no further investment, at least through the HDR UK route, should be expected. And that's why the emphasis on the sustainability plan is so important. And the final point really there about the health data finder. Again, a number of data sets are currently both in the existing health data finder that's publicly available, and also the version 2 hasn't been sort of released publicly. some of those data sets and the metadata associated with those data sets may need additional functionality, additional investment to bring them up to the standards that we're defining for the minimum viable product. But unless there's a clear need for improvement, then obviously no additional payment would be available for those data sets. So the milestones, I think the only change here really from what was in the paper is that things have shifted out a week, unfortunately, which obviously does compress timescales for us. We want to make sure it stays as the 2-week sort of gap for the dataset return as far as possible. And therefore, obviously, there is some potential slippage out to the 21st of November for that submission date, based on when you get your return template. We're also currently planning a webinar on the more detailed aspects of the metadata onboarding process. That'll be open to both Hubs and the Alliance members on Thursday the 14th. More details of that to follow, and we'll also make sure that any of these webinars are recorded. So again, they're available for those who aren't able to attend the actual session itself. We've then obviously got pretty tight turnaround times through until getting the MVP launch together, but also then a second tranche of metadata works following that initial prioritization through to the end of March. I'll now pass over to Adam just to step through some of the metadata requirements before we open up for any questions.
Thanks, David. So in terms of the metadata requirements, ultimately, this is all about making the data sets more discoverable through the gateway. So the richer the metadata you provide, the more discoverable and the more data access requests should be coming through. In terms of the kind of categorizations, we've split things up. We've started off with a summary metadata profile, which is essentially all about that first kind of rapid assessment for the engagement. So the list, essentially a list of data sets that you would like to include, things like titles, short description, contact point, and access rights, as David mentioned. Then we've got the business metadata. So the required information is information that's been prioritized by our user groups, and they've suggested that it would be really, really useful to have this information if they were thinking about making a data access request. So things like descriptions, dates, the access request cost, typical cost, the typical duration, if the data control is different from the custodian, that would be included there. So there's some information around that we'd require you to provide. It's not mandatory, but it needs to be there really for the gateway to be useful for researchers. And then there's some recommended information. And again, this improves the context. And I think it's useful to have this information anyway for all the data sets that you've got internally. So it's things like periodicity, so how often is it published, the time period that the data set covers, jurisdiction, statistical populations, age bands. There's information about format and structure, so whether it conforms to a particular standard, controlled vocabularies, high-level information like the format, the language. And then there's some information about attribution. Again, I think that's really, really important. Who created the data set? So if you cite it, what should you include in that? Whether the data set already has some citations. And again, some of this will be automated in the future, but I think at the moment we'd ask you to provide that. And then a DUI if you've got that identifier. In terms of the technical metadata, essentially that's variable level metadata. I think in the first instance, we're going to go for a quite light touch version of that. So really it will just be table name, table description, column name, column description, data type, and then a flag to say whether it's particularly sensitive. And that's a high level flag, just say, would the data be masked? Does it need to be pseudonymized? Will there be some extracts that you just won't be able to get this data? So it's kind of high level technical metadata. The enhanced metadata isn't in scope for the initial onboarding, but that would be things like profiling information. So frequency of counts within columns, some quality scores, and anything else that you think would be important as part of those data sets. So I think that's the initial category. So in terms of how we're going to ask for this, there's going to be two ways to provide the metadata. So there's going to be an online portal, and you can go through a wizard and fill in the information step by step. But we're also going to be providing a bulk upload. So if you've already got this information in a large spreadsheet and you just want to fill in the details and copy it across, we're going to provide that functionality as well. So the first template that comes out will be more in the format of a bulk upload, so it's just a list of files. But the nice thing about the portal is you can go back and update things. So if we go to the next slide, ultimately the portal gives us the capability to see how much information has been completed for each data set. So in the first instance, it will just be the A, it'll just be the summary metadata, and me and the parity team will be working with you guys to fill in all the extra pieces of information, so the required business information, coverage, format, and attribution. I think at this point, it's probably worth introducing Asher and Mike, who are on the call but aren't presenting, and they will be getting in touch to coordinate this process and help facilitate the onboarding of the additional metadata. So apologies if you've emailed me this week and we haven't got back to you. We're just finalizing that metadata specification today. So hopefully the template will go out tomorrow and we can start the process. But this is the kind of structure that we'll be delivering, and hopefully it'll provide transparency and visibility and give you a really easy way to see where you are in the process. And I think that's it from my side.
Okay, thank you. My slide seems to have frozen, so they're not actually moving on at the moment. I'm not quite sure why. We've locked out, unfortunately, on that. But I think that was our last slide anyway. And so really we can now switch across to any questions that you may have. I don't think we've had any typed in yet, but do feel free to hit the panel and ask any questions directly through that. We'll give it a couple of minutes just for people to have the chance to type. It just froze.
Yes, I think we've got a question from Richard, and yes, that's exactly what you'll be able to do. So you'll be able to go in and edit those details. The idea is we're trying to create a reproducible process for all of the sites and show how this could work in reality. So yeah.
Sorry, I'm just currently trying to show my screen. Yeah, so thanks for picking that one up, Adam. So the second question from Jeremy regarding the supplier questionnaire, that's necessary for the Health Data Research UK finance side of things, and so we'll make sure that if that's not already been sent to you, that will be sent out to all those obviously engaging in this process. It's relatively basic where the information is already collected as part of the metadata, and obviously we can transpose that across. But since it's basically a sort of separate finance function to make sure you get your monies, then it may well be something that you just need to pass across to your finance function to complete. Sorry. So the third question then is a question regarding the portal and the fact that itself is or metadata works as opposed to parity product, and isn't the solution the NHS Digital Oxford one. I'll pass this over to Adam to explain the difference, but effectively the metadata catalogue NHS Digital Oxford one will be the sort of single version of the truth, for want of a better expression. both in terms of what the portal looks at, but also then what is uploaded, what you provide to us in terms of metadata. The onboarding portal that the screenshot was shown of is purely a sort of a pipeline, I guess, an interim step to get that data into the right format and captured online and updated into the actual metadata catalogue. But it is the metadata catalogue as per the NHS Digital Oxford one, which will hold all of the metadata information post onboarding. Adam, do you want to add any clarification on that one?
Sure, yeah.
And probably pick up the next question if you can read that one out as
yes, definitely. So in terms of the NHSD Oxford product, we're pretty interoperable with it. We've got lots and lots of similarities. Essentially ours will be a gate, which will be your own kind of environment to review, to update, to get the metadata into a position where it can be published. And then the NHSD and Oxford solution is that central publishing platform that then ties into the gateway and makes things discoverable. So the idea is you'll have your own area, I guess, and you can use our product to curate that metadata. In terms of the API, I think if you would like to use an API feed, I think that we can definitely do that. I guess whether you feed directly to NHSD or directly to us would be a question we could discuss. I mean, either could work, but potentially if we're going through this review and curation process before things get published, it would go through our kind of 7-step process before that would be published. So I'm more than happy to pick that up if you get in contact with me directly, or Ashu and Mike. I'm not available the next couple of days, but I'll be back on it on Monday. So if I don't pick it up, Ashu and Mike will pick it up, and then I will be back on it on Monday, and we can work through it. I mean, ultimately, we want an automated way of sustainably providing metadata. So if there's an API feed, that's ideal.
Thanks, Adam. Do you want to pick up Mary's question, which is in the chat line as well? In terms of the bulk upload process, how much support will you be able to give in terms of ensuring the metadata files are what is needed?
So we will, 100% we'll be providing support. So we'll give you the bulk upload template, and then we'll validate it. And if there's information in there that we need to update, we'll work with you to do that. So that's really what we're here to do. Myself, Ashu and Mike are here to help with exactly that. So yes. And oh, Yvonne, that's probably free.
I'll pick up Yvonne. Yeah, great question. Thank you, Yvonne. The requirement to grant the royalty-free license. Yes, I appreciate that. Might take some time. I guess what we're looking for here really is the agreement in principle that is the direction of travel. Appreciate that will in some cases will take longer to resolve. And again, a little bit like the principal's participation and the letter of intent, we want to make sure that people are sort of aligned in terms of what we're trying to achieve, and that's not a showstopper at the outset. How that then gets sort of converted into the actual sort of license piece, we'll obviously leave to those that step through that process on that, and where there are issues raised. Again, we'll also share that learning, because I think it's important that as we're doing something new and different on this piece, that we do take this sort of contracting and legal side of things and share that out. So yes, not necessary to be able to fully confirm that within the 2-week window, and sort of it's the direction of travel, I guess, it needs to not be a showstopper. Okay, well, good set of questions so far. We'll just give people another minute or two just if there's any thoughts formulating. I mean, this isn't obviously the end. This is very much the start of the conversation about this, rather than the end of it, either directly to Adam or through me or other members of the team. Any issues, any concerns, any feedback or comments, any thoughts about how we can do it better and different? We're very open to it. Very much like to sort of hear your thoughts around that, how we engage even wider sort of set of people on this. What might be getting in the way of doing that, again, would be helpful to know. And as we obviously go through this process, what are the challenges, what are the opportunities that are presented through this? You may have all seen there's an opportunity to get more involved in the design of the gateway itself. So there was a link sent out to a number of people to volunteer to sort of be user testing on that piece. And so again, if you're interested in that, do get in touch, and we can again forward that form to support the IBM sort of user-led development phase. I think we've got one more question. Technical webinar tomorrow, or is it Thursday next week? Yeah, so I think there was in the paper, sorry, a couple more. In the board paper that went out, the original intention was that tomorrow would be the metadata onboarding sort of more detailed technical webinar. Unfortunately, due to the timescales or the challenges of finalising the actual sort of standards and the process, that has been pushed back by a week. And so we will send the updated details around for that pretty much as soon as we come off this call. And then there's also a question about how do we receive the spec for the data to be submitted, emailing it or on website. Adam, do you want to pick that one up?
Sure, yeah. So I think we can email it out. I mean, we've got a central place you can come and see it in our tool, but we'll email out the spec as a Word document and also as a template to fill in. So the initial spec will be a bulk upload, and it'll be a spec in Excel and also the Excel table that we'd like to fill in. If you want to submit that via the API, we've got an XSD, but it might be worth contacting me separately, and we can have a session where we can show you how to hit our REST API and just push it into the tool.
Okay. So question there about the Alliance and the DIHs or the Health Data Research Hubs. Is this only for Alliance and Digital Innovation Hubs? And what about the substantive sites? Again, very good question. So the investment that we're discussing today is very much focused on the Alliance. The Health Data Research Hubs are obviously part of the metadata onboarding process, and they've all got a deadline or milestone deadline of the 31st of December to be doing this, and that's obviously part of what their funding's about. In terms of data assets that are available within substantive sites, there have been some conversations about this, but not many. I will take that away and come back with an answer to that, as I can't answer that directly now. And there are obviously, it's a sort of a bit of a Venn diagram where there are organisations and entities that exist across all three of those, and obviously some that sit out just in the Alliance, some that sit just within Health Data Research Hubs, and some organisations just within the sites. So it's yeah, a relatively complex landscape, but this focuses very much on Alliance members and investing in their metadata to make that discoverable. Okay, I think we'll draw to a close there. As mentioned before, please do come back with any further questions that you may have once this webinar is finished, and over the coming weeks and months ahead. Very much appreciate your support, appreciate your time on this call, and your commitment to making sort of the UK's health data more accessible and discoverable for research and innovation. Say thank you very much, Steve, for your time. We'll close the webinar now.